we're just gonna go over some basics of the bed. If you guys have any questions, let me know. We'll start up here. On both sides, you're gonna see a red sticker that says CPR release. So if you're ever in a situation that you need to quickly drop head of the bed, you're just gonna squeeze the handle and then go down. Make sure you go down with it because it'll go down kind of fast and you don't want the bed pulling you down. But it won't pinch your fingers, don't worry about that. Just squeeze the handle and let the head of bed drop. When it comes to the bed alarm, we'll talk about this in a minute, but this needs to be plugged in here to your 37-pin connector. So it goes from the back of the bed here up here. If this is not plugged in, then what happens is when you have a bed alarm alarming because maybe a patient's trying to get out, it's not going to send a call to the nurse's station. So this being connected properly allows the bed to communicate to the call station. You also may have lights outside your room. If this is plugged in, the light will light up when your bed alarm's going off so you know, okay, which room do I need to go to before the patient falls. So that's important there. You have all your basic functions here. We won't go over those. Everything is really self-explanatory. Your side rails, you're gonna pull this back, pull it in to go down, and then back up. Brake pedal's nice and big, it's right in the center. So if you just step on it, that's gonna take your brake, that's gonna put your brakes on, your first click. Again, it'll pop back up, take your brakes off. That's it on this end up here. We're now gonna travel down that way and we can go over everything else in the footboard. So starting down here, this is where you have your lock. So this is your bed motion lock. If you press this button, it's going to lock every function on the bed except for every electronic function, except for the CPR. Even though it's electric, it's still gonna work. Your quick drop release is still gonna work. But if this is locked like this, you're gonna see it's illuminated here. That means that all these buttons are all locked out. They won't work. So to unlock that, you're gonna do this. And this also locks the side rail buttons. So this is the whole bed motion lock. These lock individual functions only, and only the patient controls. So here, that'll lock your head of bed. So you can have your head of bed flat, you can have it up, down, but if you press this button, it's gonna stay there and it's gonna be locked in place. To unlock it, again, you're just gonna do that. This is gonna lock your knee section, so when you raise your head of the bed, your knees won't move with it. And then this is gonna lock your height of the bed. So if you have a fall risk patient, you can take it to the low height, lock it out, and that's a nice deterrent so they're not easily able to raise it up. This is your Trendelenburg and reverse Trendelenburg. This is the only place that this is on the bed. So if you're ever up at the side row and you're like, where's Trend? It's not gonna be there. So this is the only spot you can do the Trendelenburg and reverse Trendelenburg. These are your basics. These are also on the side rails like we saw earlier. Same with these two functions here. This is just your electronic CPR. So if you have your head of bed up, knee up, maybe the bed's high, whatever, you can press and hold this button. It's gonna quickly, electronically, as fast as that can go. If you hold it, lower, drop head of bed, drop knees, all kind of in one button. You can also use that button if you're just wanting to make the bed up, flatten it out, position the patient. It doesn't move that fast, so. This is your bed alarm system here, which we'll go over. Before we do that, I'm gonna cover the scale system. So with the bed scales, just like any bed scale, you have to zero the bed before the patient gets in the bed. If you don't zero the bed, then the bed's not gonna give you that accurate patient weight when you go to weigh the patient. So if the bed was zeroed with the sheets, linens, your basic makeup like this, when you have your patient in the bed, it's gonna be plus or minus 2% accuracy. If the bed was not zeroed, it will be not accurate at all, basically. Mm-hmm. So what happens if you don't zero the bed is that patient gets in the bed. The bed senses that patient's weight, but it also has the old patient weight in it. So it'll take the difference in the patient weight that it's sensing that's there and the patient weight that's logged into there from the previous patient, and it'll think they weigh that. So sometimes, depending on the difference, it might think they're 75 pounds, it might think they're 200, it might think they're 30 pounds. And so if you ever go to turn on your bed alarm and it says too little weight on the screen, that means that you didn't zero the bed or somebody didn't zero the bed, and that the difference in the current patient weight and the patient that was in the bed previously is less than 50 pounds. Because you do have to have 50 pounds in the bed for it to let you weigh the patient and set the bed alarm. So once you get your bed zeroed, then you can use your bed alarm. The bed alarm system is going to track the patient's weight as the patient moves around in the bed. So what happens is it's going to alarm once 80% of the patient weight is outside of the invisible zone. So when you first get into the bed, you get your patient in. You are going to turn on your bed alarm. So if you just press that button that says arm disarm, so that's how you turn it on, you're gonna arm it. And so now your bed alarm's on and it's on that first red box, right?
Yeah.
So you have the 3 red boxes, different levels of sensitivity. This one is the least sensitive zone. The one I'll show you on the far end is the most sensitive, and the one in the middle is the best one to use generally. With this one, as long as the patient weight is on the bed in some way, shape, or form, it will not alarm. You can stand up in the bed, they can do whatever they want. So if they're here, it's still not going to alarm. So it's not going to alarm until the patient's 80% of the patient weight's outside of this invisible red box, which is the whole bed. So my feet are both on the floor and out of the bed.
Ooh, if you don't have brakes on.
Don't forget that. The bad kind of distracted. The worst thing
Really
ever.
dangerous.
Okay, that was perfect. But yeah, so the bed alarm. So that's the first zone. I would just say I wouldn't use that zone. If you have a fall risk patient, that first zone is not going to give you any time to get into the room. It's almost pointless, right? If you have a patient that's eating lunch and they're sitting on the side of the bed, that's fine. That would be the only thing I could think of if you may want to use that zone. Or if there's a patient that's not a fall risk patient, but you want to know when they are up for whatever reason, then you could use that zone. So you want to use the middle zone or the last one. So if you arm it and then press the button that says zone, and that's how you toggle to the next zone. So once you turn it on, it goes to that one that we don't want to use. Press the button that says zone, moves you to the middle. So with this one, we're in the middle. So the great thing about this is it doesn't work off of pressure like the old bed alarms, like pressure pads here. So you lift up and it starts beeping. So it's just tracking the patient's center of gravity. So it's not going to give you those false alarms. It's going to let me move around as long as I'm somewhat centered. Patient moves too far to the right or left. Yeah. So they truly have to be shifting their weight outside of this smaller red invisible box that they're in. And then the last one is the most sensitive. So I can show you that one. Just arm it, press zone twice till you get it to light up that little tiny box. And so this one is going to alarm, pretty quickly. Sometimes we need that, right? But generally speaking, the middle one's going to work the best. So like I was saying earlier with the scale system, that's where everything kind of gets a little hairy. I'll hear, oh, the bed alarm, it's just beeping, they're barely moving, or they're almost out, why is it alarming? And it all goes back to the scale system and the bed being zeroed. So it's tracking, it needs that accurate patient weight. You can zero the bed, unplug it, send it somewhere, it's still zeroed. Just make sure your stuff's on here like this. So that is our bed alarm. We went over Trendelenburg.
And the aspiration lock?
Yes, so this 30 degrees. So if you know you want your patient to stay 30 degrees or higher, then you're gonna press and hold this button and you'll see the head of bed moving. Once it stops moving, it's at 30. You do have to hold it till it stops. So now it's at 30. So if someone is trying to lower the head of the bed, it's not going to go. It'll let that person go up, but it's just gonna keep stopping at 30, which can be good, right? So there's a reason for it, but it's good to know so that you can lower that if needed. So you would just have to turn off the 30 degree. And now that it's off, you see it's not lit up anymore. That means that from any button, head of bed can go up and down.
And what if you have that turned on and you need to do CPR?
It's gonna override. Yeah, so if you have that turned on, CPR is the manual. So this is always gonna work. They always. Never seen it not.
And lastly, and I think the last thing we need to cover is the low air loss pumps, and like where do you attach them, and
Exactly.
what do we need to know about CPR with those if we're using the pump?
Yep. So the thing with the CPR, real quick, is that the mattress has it's the gelastic material, and there is tubing. There's air tubing that runs along all through the inside through the gel, and the tubing has holes in it. So the holes, the air is pushed through the pump and then blown up to the patient's skin from the holes alongside the tubing under here through the cover. So there's nothing to inflate or deflate. So there's really not a CPR issue with air being in the mattress, but what we're supposed to do is disconnect the mattress, the pump. So with the pump, you're gonna have it hanging here, and then you're gonna have it attached right here. So this little black thing screws off, the attachment screws on there, and then the pump hangs here, and the hose comes around here and connects to the pump. There's a squeeze disconnect on the pump that'll connect the air tubing.
So that'd be the fastest way to get it unplugged. Okay.
Yeah, but it's not going to deflate because it's not blowing, and so yeah. So this is a gelastic material. It's a honeycomb design. It does a great job Pressure redistribution, preventing shear and friction. The gel moves with the patient's skin versus the foam that'll tug on the patient's skin, so it's really great for that. Yeah, it's mostly just the gel material. There's a lot more gel in the sacral area. There's the core gel, and then there's the top gel.
Can you tell us anything more about our mattresses that make them special?
Gosh, I mean, you guys should be getting great results with these mattresses. They do a great job. Like I said, the gel keeps the patient's skin cooler. It's got the core gel in the center, does a great job of buckling and providing immersion and absorbing that weight. So it's great for pressure redistribution. And you can quickly add a pump. So you don't have to order a mattress. You don't have to wait on one to get here. You don't have to move the patient. If you have pumps, you just hook it up, and that's going to give you that moisture management that you're going to want to help.
Thank you. Is there anything else that we need to know about our beds?
That's a trick question. No,
Big stuff.
Not that I can think of.
Okay.
Gosh,
Not that it was
here.
absolutely comprehensive in terms of a legal
I know.
perspective.
What are we gonna do?
Any other high points?
No, I would just say if you have a tall patient, don't rent a bed. Just get a bed extender. Y'all may know that, but sometimes I see there's a bed extender that can be ordered from Stryker. You would take the footboard off, put the extender on, and the footboard goes on the bottom of the extender.
And
So
what's
you
the
don't
weight
have to
limit
rent.
on this bed?
The 500 pounds.
Okay,
Yeah,
excellent.
500 pound weight capacity.
Okay, thanks, Leah, for being
Of
here
course.
today.
Thank you.